Hello, everybody. We're here for session 3, and we're going to finish chapter 1. And we're starting with pioneers in dental X radiation. So, after the discovery in X-rays in 1895, a lot of people helped change the shape of history with dental radiography. The development of dental radiography can be attributed to the research of hundreds of investigators and practitioners. So many of the early pioneers died from overexposure to radiation because they didn't know how dangerous it was. At the time X-rays were discovered, nothing was known about the hidden dangers that resulted from using these penetrating rays. I mean, they were invisible, they're odorless, colorless, tasteless. So shortly after the announcement of the discovery of X-rays in 1895, a German dentist, Otto Walkhoff, made the first dental radiograph. He placed it in a glass photographic plate, wrapped it in black paper and rubber in his mouth, and submitted himself to 25 minutes of X-ray exposure. So now when we take an X-ray, it's literally like a hundredth of a second, like impulses is what it's called, that we take the radiation and expose people to. So like fractions of a second. Now, he was sitting there for 25 minutes being exposed to X-rays. In that same year, W.J. Morton, a New York physician, made the first dental radiograph in the United States using a skull. And he lectured on the usefulness of X-rays in a dental practice, while he made the first whole body radiograph using a 3x6 sheet of film. So these people made such contributions to everything that happened in dentistry. C. Edmund Kells is another one of the pioneers in dental radiation. He was a New Orleans dentist, and he's credited with the first practical use of radiographs in dentistry in 1896. Kells exposed the first dental radiograph in the United States using a living person. While he was experimenting, he exposed his hands to numerous X-rays every day for years. That overexposure to X radiation caused the development of numerous cancers in his hands. Kell's dedication to the development of X-rays in dentistry ultimately cost him his fingers, later his hands, and then his arms. So even though he continued to lose parts of his body, he still persevered through all of that and continued on with his study of X radiation and developing things for science. Other pioneers include William H. Rollins, a Boston dentist who developed the first dental X-ray unit. While experimenting with radiation, he suffered a burn to his hand. This initiated an interest in radiation protection, and later the publication of the first paper on the dangers associated with radiation. Frank Van Woert, a dentist from New York City, was the first to use film in intraoral radiography. Intraoral radiography means intra, inside, oral, mouth, inside the mouth, versus using the film extraorally, meaning outside of the mouth. So Howard Riley Raper, an Indiana University professor, established the first college course in radiography for dental students. Table 1.1 in your book highlights the history of dental radiography. The development of dental radiography has moved forward from these early discoveries and continues to improve even today as new technology becomes available. So when we look at the history of dental X-ray equipment, in 1913, William Coolidge, an electrical engineer, developed the first hot cathode ray tube. It's a high vacuum tube that contained a tungsten filament, and it became the prototype for all modern X-ray tubes and revolutionized the generation of X-rays. In 1923, a mini version of that X-ray tube was placed inside the head of an X-ray machine and immersed in oil. This served as the precursor of all modern-day dental X-ray machines and was manufactured by the Victor X-ray Corporation of Chicago. And then later in 1933, General Electric introduced a new machine which improved features. From that time on, the dental X-ray machine changed very little until a variable kilovoltage machine was introduced in 1957. So variable kilovoltage machine, KVPs, kilovoltage. Make sure you understand that that's something important that you're going to need to know. We'll talk about kilovoltage later in the book. And in 1966, a recessed long beam tube head was introduced. So from 1896 to 1913, they used hand-wrapped glass photographic plates or film. Now, think about that. If you've had a dental x-ray, which I'm sure you have, now they're nice and flexible. If you could just think about having a hand-wrapped glass photographic plate in your mouth, how uncomfortable that had to be and how big and bulky it was. And then in 1913, here comes Eastman Kodak, manufacturing pre-wrapped intraoral film. So the film that goes inside your mouth, it's pre-wrapped. They don't have to hand wrap them before they go in, and I'm sure they were a lot more flexible then. And with these film packets, when they were hand wrapping them, they had to be careful because light cannot pass through these film packets. So they can't get light inside of it. Only the x-rays can pass through the film packet. Now, when we talk about the history of dental radiographic techniques, the Edmund Kells in 1896 introduced the paralleling technique. The intraoral techniques used in dentistry include the bisecting technique, the paralleling technique, and the bite wing technique. So in dental assisting schools today, the paralleling technique is taught. So that is what you will be taught here. It was introduced by C. Edmund Kells in 1896. This F. Gordon Fitzgerald, the father of modern dental radiography, revived interest in the paralleling technique with the introduction of the long cone paralleling technique in 1947. So the extraoral technique used most often in dentistry is the panoramic radiography. So extraoral, they still do use extraoral film in radiography, but the most often it's the panoramic technique. And that was introduced in 1933 by Hitsu Numata of Japan and was the first to expose a panoramic radiograph. So that's that big full mouth x-ray that you can see from one side of the mouth all the way to the other, and all of the teeth where they sit in the jaws in the mouth. So you can see all of the dentition in one big x-ray is a panoramic, or they call it a pano or a pan, but ultimately it's a panoramic x-ray. The smaller film x-rays that you take individually also can have different names, even though they're the exact same size film. It just depends on the location that they're taken in the mouth. They can be called a periapical, or for short, PA. They can be called a bite wing. They can be called an occlusal film. So it depends on where the film is taken at in the mouth, what type of film, what type of x-ray it is, or x-ray film it is. So when we move on to dental imaging, radiographs have been produced using photographic film for over a century. Traditional radiography is being replaced, though, by digital imaging in the dental office. So more and more offices are using digital radiography, but don't let yourself be fooled and think that you only need to know digital radiography, because you do not. You don't ever know what kind of office you're going to be working in, and it may have digital and state-of-the-art everything, but it may not. Also, you need to remember things break, things fizzle out, electricity goes out, whatever, but you still need to know how to use your backup, and your backup is your old school X-ray unit, which they're still going to have in the office. Because most of the time, the digital units they have in the office were originally regular X-ray units that are converted to digital. So they can actually take film X-rays and digital X-rays. Digital imaging allows for instant and easy transmission of images and electronic storage. So it's really nice because they're capable to reduce patient exposure to radiation while increasing diagnostic potential, and it has a profound implications. So in addition, chemical waste associated with traditional radiography is reduced, which benefits the environment. Because with traditional X-rays or radiography, we have to use chemicals to process the film with fixer and developer. You don't need that for digital X-rays. You also have to have a place to store the film. With digital X-rays, it's stored right on the computer in the cloud, so you don't need storage for that. So over time, after you get over the initial startup expense of the digital X-ray equipment, once that's paid off, it does save a lot of money in the long run. You're not buying film, you're not buying chemicals, you're not having to worry about that developer breaking down, things like that. But it is expensive initially to switch over to digital to get the equipment. So that does hinder a lot of people from doing it. But like I said, you still do need to know digital because you never know when you're going to need that as a backup. So in 1947, they had that long cone paralleling technique they were using. And then, like I said, we used that panoramic radiograph in 1933. And then they started experimenting with slit beam radiography, intensifying screens, and rotational techniques, which is what they use when they're using that panoramic machine. So that panoramic machine is very helpful when you're trying to view the upper and lower jaws in one radiograph. Radiographs have been produced using film, like I said, for over a century. But now we're getting into that awesome age of digital. And the first digital sensor was introduced in 1987. In 89, an article describing direct digital imaging technology was published in the US dental literature. Since then, digital imaging technology has become widely accepted and has evolved with improvements in sensor design and supporting technology. With 3D imaging, in 1999, cone beam computed tomography was introduced to dentistry, and that allows for viewing of oral structures in 3 dimensions. So this digital imaging will have a considerable effect in the field of dentistry. So they use this a lot when they're doing implants. So they know exactly where to put the stent and the implant post, and they can guide it into the bone safely and correctly. In 1999, the American Dental Association, or the ADA, recognizes its 9th specialty program, oral and maxillofacial radiology. So this is a new specialty. There used to be 8 specialties in dentistry, now there are 9. It provides advanced training in radiology of the oral and maxillofacial region. 2 to 3 year residency term after completion of dental school, followed by an international board examination, is what is required to become a specialist in this area. It joins other specialty programs in dentistry, including oral and maxillofacial surgery, orthodontics, endodontics, pediatric dentistry, periodontics, prosthodontics, dental public health, oral and maxillofacial pathology, dental anesthesiology, oral medicine, and orofacial pain. So if you have any questions in regards to this lecture, please reach out to your online teacher and they will answer anything that you have. Thank you.